this is Dr. John Martinez with the Healthy MD, and back with another video, unfortunately, about COVID. When I first started this channel, I thought, hey, I'd be talking more about health, fitness, nutrition, wellness, and prevention. But when you start this in the middle of a pandemic, I think most of the question I've been getting, at least as a physician, is about COVID-19. So today what we're going to do is focus really on COVID-19 in children. So this is really aimed at parents, teachers, and family members that have young kids, because there's been a lot of reports about how Delta variant of COVID-19 is really affecting children as well. And with this being August and kids going back to school, there's a big concern of, are we going to see even a bigger uptick in COVID-19 cases as kids get back to school? And what do we need to know to keep them safe? What can we do to keep them safe? And what can we do moving forward to kind of help mitigate and kind of slow down this whole pandemic spike that we're seeing? So we know that the COVID-19 Delta variant is causing a big surge. More transmissible, easier to catch, easier to spread. I did a video on this. You'll see that pop up, and I'll link to it underneath so you can watch that if you have not watched it, but kind of go through and explain at least a little bit of the basic science and kind of the math behind how quickly it can spread, to give you guys really more of a sense of scope of how serious we're taking COVID-19 Delta variant, even compared to the previous COVID-19 variants that we've seen out there. But the one thing we're seeing with COVID-19 Delta variant is increased hospitalizations across the board for the unvaccinated, and that means adults as well as children. And that's kind of our biggest concern, is that we're seeing this hit kids harder, at least the Delta variant. Before, with the previous variants, COVID-19 didn't seem to hit kids as hard. The kids got sick, but not ending up in the hospital. Pediatric deaths compared to adult deaths were lower, still happening. And I think that's our concern now, is that we're seeing pediatric hospitals start to fill up across the country. If you look at Louisiana, Mississippi, Alabama, Florida, their hospitalization rates for pediatric cases are way up, even compared to last December, January, when we had a previous spike. The same thing we're seeing in the Southwest. So you take California, Nevada, Arizona, even though they're not at pandemic heights for pediatric hospitalizations, there's still been a pretty significant increase in hospitalizations over the last 4 weeks. And that's really a concern for all of us in the healthcare field. How are we handling this influx? So now we have children who are going back to school in areas with low vaccination rates, and that also fights over mandatory masking policies in the schools. And that is a potential setup for even further spread of COVID-19. Now, just a little bit of background, how serious is COVID-19 for kids? Death rate's about 1 out of 100,000. That's 0.001% of that. But with over 2 million children that have had COVID-19, there's still kids that are dying from it. So it's not something that's an unsubstantial number. And obviously, if it's your child or someone that you know from the neighborhood or from the school that dies from COVID-19, that really becomes more of a reality than just a number. The other issue that we're seeing right now in August is that there's also an increase in other pediatric respiratory viruses, specifically RSV and parainfluenza. And we usually see these in November, December, January. These aren't infections that we typically see in the summer. So we also have an influx of younger kids, because parainfluenza and RSV usually hit kids, infants, newborns, toddlers, so the kids under 2. And now we also have the surge with the COVID-19, which is hitting kids probably 6, 7, 8, 9 and older as well. And that combination is really overwhelming to not only the emergency departments, but pediatric floors and pediatric hospitals that specialize in. The other issue with COVID-19 is that we're seeing a new syndrome called MIS-C, which is multi-inflammatory syndrome in children. There's also a MIS-A, which is multi-inflammatory syndrome in adults, but really concerned about this MIS-C because it turns out it's more of a long-term syndrome that some kids who have been infected with COVID-19 then develop after the fact. So they make it through the acute infection, but then they have this inflammatory response, either their heart, lungs, kidneys, brain, liver, GI tract, and it's really kind of a chronic and debilitating disease. And so we're still trying to wrap our heads around what this disease is, how we treat it the best. There's been about 4,000 cases reported in the U.S., and that's up until about the beginning of June. So we expect to see more cases of MISC as well too. And I think that number is going to unfortunately continue to climb. Now listen, I'm not an expert in measles, polio, and a lot of other diseases that we just don't see anymore. And the reason for that is vaccines. What we don't want is for the current medical students, nursing students, residents, interns, brand new attendings to become experts in MISC. And if they are, it's because they're seeing too many cases of it. So the more we can do to limit the spread of COVID-19, protect children, the less of this we're going to see. And hopefully this will just become a footnote in medical textbooks down the road. So as a parent, what can you do? Kids under 12, obviously, at least currently, can't get the vaccine for COVID-19. So the other way to look at it is vaccinate everyone in your household who's 12 and over, and that can qualify for the vaccine if they don't have any other underlying medical issues that would prevent them from getting the vaccine. We talk about herd immunity in a societal standpoint. Well, we also need to look at herd immunity in households as well too. How many other people in your household can get that vaccine, prevent the spread of COVID-19 so that children under 12 don't get it as well too. And I think that's one of the biggest things we need to continue to focus on. The mandatory masking in schools. I think there's enough research that shows over the past year that mandatory masking has worked. And there's been a few decent and well-done studies out there. Duke University did the ABC Science Collaborative study with 100 school systems in North Carolina. And they did this through last year, looking from March to June of this year on how effective mitigation plans as far as masking, ventilation, and other things as far as trying to prevent the spread of COVID in the classroom work. And they found that the classrooms that actually used mandatory masking had much less cases of COVID-19 than the classrooms or the school systems that didn't have mandatory masking. And I think that's important because if you're a parent and you send your kid off to school and another kid gives your kid COVID-19, they have to quarantine. They have to stay home. And then now with everyone trying to return to office and return to work in person, that puts parents at home too. So I think that's the other kind of domino effect that we haven't talked about, is that this quarantine effect with the school systems as well too. Georgia's also looked at this too. So this isn't just one state doing it. Georgia also did a survey, and this is the one study that probably isn't as high quality just because they didn't get enough survey responses. So they tried to survey all the school systems in Georgia. They only got about 11% response rate. But when they went through all the data and found out what the schools reported, doing the mandatory masking, increased ventilation in the room, so having windows open, doors open, fans kind of blowing through that would disperse out any virus that was in the rooms, all seemed to really help as far as number of COVID cases that were reported in those school systems compared to the Georgia school system data across the state too. So I think that's important. Talked about the quarantining, and I think that's the one thing that we're missing on this as well too, is that your kid may not get COVID, your kid may be exposed to COVID. And if that happens with no mask, they have to quarantine. Same thing for school teachers as well too. We had a case in Reno, Nevada, where a family sent their kid with a known positive COVID test to school. And the result was that 80 students and staff members then had to quarantine because they were exposed to this student who wasn't masked, COVID positive, and then they're also at home too. So you can see kind of the disruption of just one case affecting 80 other people that may have been trying to do the right thing. And I think it's interesting when I look at this from a physician standpoint. I get parents and school systems or daycares are panicked when one kid gets pink eye, conjunctivitis, and that it's going to affect the entire classroom and all this, and they need documentation and notes before that kid can come back to the school for pink eye. Same thing with lice. Oh gosh, if I get one kid that comes into the office, urgent care with lice, then it's, the entire classroom, is then coming in to get checked out for lice. Why are we not doing the same thing with COVID-19? That doesn't make sense. So, just to kind of wrap this up real quick, What can parents do? I think number one is vaccinate everyone in your household over 12 years old. Do that herd immunity within the household. Try to keep that social bubble that you've been having previously as far as trying to prevent spread of COVID-19 too. Have small play groups, keep those kids isolated from other groups as well too. I think the mandatory masking, there's enough science that shows that it works. I mean, the North Carolina collaborative study had over 1 million students and staff members over 3 months that they looked at, and their data was pretty impressive on that. So I don't understand why this is such a, why this even becomes a political issue. This is basic science. This is public health. This is just good stewardship as far as trying to keep people safe. So I'm Dr. John Martinez from the Healthy MD. That's all I got today for the Delta variant and school systems and kids and parents. But if you like the video, be sure to hit the like button below, subscribe to the channel. I will have other videos coming up. Next one on COVID is going to be talking about who should get the booster shot, who should not. Are booster shots going to be necessary for all of us or just some of us? So look for that one. And then hopefully we'll get back on track as far as some of the real health, wellness, fitness, and prevention videos I really wanted to do originally. So this is Dr. John, and talk to you later.